A big hi to all the viewers. I am Dr. Hardik Thakker, an MD physician practicing from Mumbai. I would like to take this opportunity to talk about diabetes mellitus. As we all know, diabetes is a very common lifestyle disorder that we see in India. In fact, 7.1% of the Indian population, adult Indian population, is afflicted by this disease. If you go by world ranking, India ranks 1 among the total number of diabetic patients in India, followed by China and United States. So this number, it by itself shows the burden of the disease. Now what I commonly see in our practice is there are a lot of newly diagnosed patients who do not have any symptoms, but they have just done a random sugar check and they are diagnosed as diabetes. So the moral of the story is one does not need to have symptoms. Typically a diabetic would have a history of increased urination, increase of water intake, weight gain or weight loss, or sometimes they may develop complications like eye issues, peripheral neuropathy, which is tingling and numbness in the nerves, and sometimes they come with foot ulcers, but a majority of the patients are asymptomatic. So a sincere request to all the viewers to have your sugars checked once a year at least, just to be sure that you are not missing out on your own disease. Now I would be speaking more about the types of diabetes and why does it happen and what all things happen in diabetes. So there is type 1 diabetes, which is found in people less than 20 years of age, wherein there is autoimmune destruction of the pancreas, because of which the secretion of insulin is not there and hence the sugars are high. These patients need only insulin. There are no medications for these patients. The second and the most common type is type 2 diabetes, which you will find in people above 40 years of age. And the typical age in Mumbai or in India for that matter is 42 years at the age of presentation, and they are usually treated with medications and sometimes with add-on insulin. There is a third uncommon variant called as MODY, which is the MODY, maturity onset diabetes, which also needs insulin, and it has some autoimmune disorders and some genetic predisposition. So these are the types, and what happens is when diabetes, because the sugars are high, sugar is present in the blood in very high amounts, it damages a lot of your organs. For example, the most common organ is the nerves, so it leads to neuropathy. People get tingling and numbness in their nerves. Second most common organ is the heart, because of which there are blockages in the heart. It leads to heart attack. The third common is the eye, especially the retina. It causes a retinopathy and people have decreased vision and sometimes they see floaters in the eyes. And the fourth most common complication is a foot ulcer. Okay, so these are the complications and we do not want people to have it. Hence the reason to diagnose early, treat early and eat right. With regards to lifestyle management, I would sincerely request diabetic patients to have a brisk walk for 30 minutes every day. This by itself will increase your insulin sensitivity and help you to decrease the dose. And second thing is eating healthy, which makes a huge difference to your sugar levels. To have a very low carb meal, specifically avoid sugars, and exercise. So that's all I would like to say on diabetes. If you wish to contact me further and you would like to consult with me in private, I would request you to go through my website, which is www.drhardikthakker.com, and you can even get in touch with me through Lybrate.com. Thank you very much for your time.